The Affordable Care Act has been an act that's been discussed numerous times. As Caribbean people, do we understand the contents of that law and how it impacts our lives? Today we're going to discuss this and debunk some of the contents of that act. Stay tuned. Carib Nation is up next.
When America wants to know what's happening in the Caribbean diaspora, there is one clear choice.
Hello, welcome to Carib Nation.
Both people inside and outside are
very excited about today's program.
Looking at you, I can tell that you have traveled the journey.
One television organization brings America close to the people, stories, and events that affects Caribbean life. Get close, get answers, get Carib Nation.
Back to Carib Nation Television. My name is Abby Charles.
I would now like to call up to stage some of the members of Congress who helped make this day possible and some of the Americans who will benefit from these reforms.
The Affordable Care Act is a significant law that impacts our lives and will be in full implementation in 2014. It was introduced in 2010 by President Barack Obama, and it affects access to health care for all Americans, but especially Caribbean immigrants, who we focus on here at Carib Nation TV. We're going to be talking about how they access the Affordable Care Act. Today, our guest is Ms. Jenny Rejeske from the National Immigration Law Center, and she's a health policy analyst there. Welcome, Jenny. Thank you so much for joining us today.
Thank you.
All right. So, as we think about what this Affordable Care Act means for Caribbean immigrants, people who are here both documented and undocumented, can you tell us what's in the Affordable Care Act for us?
There's a lot in the Affordable Care Act. The Affordable Care Act really focuses on insurance. It's a huge law. There's lots of things that are in the law. But what the real focus has been on is expanding access to health insurance for Americans. And in general, people who are citizens, people who are here lawfully, they're lawfully present immigrants in the United States, they have access to all the benefits of health reform.
Right. Awesome. Does the Affordable Care Act change how immigrants access healthcare benefits right now? Are there any changes in the law?
Most of the changes go into effect in 2014.
Okay.
Some things that one of the biggest things that happen is that the Medicaid program, which is the government health insurance program for low-income people, and the Children's Health Insurance Program, which is for children, those programs are expanding in many states in 2014. So those expansions haven't gone into effect yet, but we still have the Medicaid and the CHIP program. The immigrant eligibility for those programs did not change with health reform. So in terms of which immigrants are eligible for Medicaid and for CHIP, that doesn't change after 2014. But the income levels go up. So individuals don't have to be as poor in order to access those programs. And so it expands access to that full coverage health insurance, the government health insurance for those people who meet the immigration requirements for Medicaid. And then in 2014, access to private health insurance will expand greatly. And even more immigrants will be eligible for those programs. And most immigrants in this country are either citizens or are lawfully present. And since that's really the criteria for eligibility for the health insurance programs in the Affordable Care Act, then most immigrants in the U.S. will benefit from those.
Right.
And in private health insurance, they're setting up these new things called health insurance exchanges, affordable insurance exchanges, which are these new places where people can go to buy private health insurance, and they're going to be in every different state.
Right.
And so lawfully present immigrants and citizens will have access to private health insurance in those new insurance exchanges, and they'll also be able to apply for discounts that will make that health insurance more affordable.
Right, right. Now, there's about 3.5 million Caribbean immigrants as of 2009 who reside in the U.S., making up about 9% of the foreign-born population here. And, most of those people are going to have to access some sort of health insurance when this act is implemented. And I've heard about these healthcare exchanges. Can you tell us a little bit about what is the health insurance exchange? How does it work? How do people access it?
Sure. So it's new in most states. There's a couple states that already have health insurance exchanges. One of them is Massachusetts, which already has their health reform law operating. And then Utah also has a health insurance exchange. But after 2014, there will be a health exchange in every single state.
Okay.
Even in those states that have said they don't want to have anything to do with the president's health reform law and they don't want to implement it, in those states, the federal government is going to come in and step in and operate a health insurance exchange. So it will be operational in every single state. And what it does is that it makes it a lot easier to shop for private health insurance.
Okay.
It's also going to be the one place that you can go to apply for Medicaid, for CHIP, as well as for private health insurance. It'll be more standardized. People will be able to shop and compare plan to plan really easily. And they'll be able to apply for these discounts to make private health insurance more affordable if they're not eligible for Medicaid or for CHIP.
Okay.
And people will be able to apply in person. There'll be places they can go in person to get help and to apply for private health insurance or for Medicaid or for CHIP. They can also do it online. There will be a website in every state that they can apply for the health insurance exchanges. They can do it over the phone. And then there's also going to be this network of assisters and consumer assistance programs in every state and throughout the country. So people will always be able to go somewhere and get help. Right. It may be at the local hospital or a community health center may be able to help people apply for insurance. It may be at a local community organization that works with Caribbean immigrants. They might be able to help provide health insurance, and so, or help people connect to the exchanges.
In thinking about the Affordable Care Act, some pieces we've heard are implemented early. Can you tell us a little bit about what has been implemented already in the Affordable Care Act?
Sure. So one of the big important programs that was implemented right away is something called the Pre-Existing Condition Insurance Plan.
Yeah, tell us about that.
So after right now, there are many health insurance companies that will not offer health coverage, will deny people coverage if they have a serious or chronic medical condition.
Yeah.
They just can't, there's no option for them to get private health insurance. After 2014, that'll no longer be the case. Insurance companies won't be able to discriminate against people if they have a serious or chronic medical condition. So until 2014, what the health reform law did was it created these pre-existing condition insurance plans. So in the meantime, there's these special insurance plans specifically for people who can't get coverage elsewhere or who are denied coverage elsewhere, but they have a serious or chronic medical condition. So this is stuff like asthma, diabetes, high blood pressure, heart disease, cancer, HIV and AIDS, depression and anxiety. I mean, it's a pretty broad group of medical conditions. And so everyone can, again, in this program, it does have the immigration restrictions, and so you have to be either a citizen or a lawfully present immigrant, which is pretty broad too. It includes people who have green cards, it includes refugees and asylees, it includes people who are in the process of applying for their green card. In most cases, if you're here with permission of the government and you have a work permit, then you'd be eligible for the pre-existing condition insurance plan, and you have one of these medical conditions. And it creates it brings all of these people together into one pool, which means that the cost of health insurance goes down. So it's a lot cheaper than going out right now and buying private health insurance, even if somebody could. So it'll be cheaper, not as cheap as it will be in 2014, but cheaper than it is than it was before.
Now, what about people who are here as students, either on a F1 or a J1 visa, or Caribbean people who are here on a work visa, H1 status? Can they access any of the benefits of the Affordable Care Act?
Yeah, actually. So people who are here on temporary visas, with the exception of visitor visa, really. But on the employment visas and student visas, they are considered lawfully present. They're here with the permission of the government. And so they have access to buying health insurance in the exchanges and even to getting the discounts that will make health insurance more affordable. They're tax credits, actually. Most people on temporary visas aren't eligible for Medicaid or CHIP. They're not eligible for that now in most places, but they will have access to more affordable health insurance in 2014.
There are a number of Caribbean people here who are undocumented as well. You know, I think the last thing I was reading said about 350,000 in 2009 Caribbean people were undocumented. You know, are there aspects of the act that undocumented people can access?
So that was a big controversial issue when health reform was being debated. People may remember. And we, our perspective, and a lot of advocates were fighting for, a lot of people were fighting for health reform that covered everybody regardless of status. And then it became an issue later on. And so you may remember when the president was addressing Congress and he was talking about the health reform bill, and Congressman Joe Wilson yelled out, "You lie," when he was talking about how undocumented immigrants won't have access to the benefits of health reform. And so as a result of that outburst that has become pretty famous, they went even further and excluded undocumented immigrants from all of the benefits of health reform, including buying health insurance through the exchange at full price with their own money. So someone who's undocumented basically is left with the same choices that they have now. But one important thing I just want to mention is that many immigrant families have people who are lawfully present in it and people who are undocumented and haven't gotten status yet. And so for those situations, health reform definitely gets that. And Congress got that when they passed health reform. And so they absolutely recognize that mixed status families will be going to the exchange to buy health insurance. And so it's only applicants for health insurance that have to prove that they're a citizen or lawfully present. So if, say, a parent is undocumented and they want to apply for health coverage for their citizen child, they can still apply for health insurance. They won't be asked for their immigration status for themselves, only for the child. They may have to prove their income, that kind of thing, if they want to get a discount for that child. But it's safe for them to apply. It's safe for mixed status families to go to the health insurance exchange, and they do not have to disclose their immigration status if they're not applying themselves.
These undocumented immigrants, I have tons of questions about what does that mean for their health care. So we're going to go to a break, but stay tuned, because when we come back, we're going to get some more information on these many people who are from our communities who may not be documented and may not have access to the Affordable Care Act. Stay tuned. Carib Nation will be back. So welcome back to Carib Nation Television. This is Abby Charles, and I'm here with our guest, Jenny Rejeske of the National Immigration Law Center. And we're debunking the Affordable Care Act for our Caribbean people. We just heard a little bit about undocumented immigrants and their access to the Affordable Care Act, which is limited. And I'd love to hear from Jenny a little bit more about what federal programs are there now that undocumented immigrants have access to from the perspective of their health care?
Not many. There are a few, but there are a few important ones.
Oh, good.
So for full scope or full coverage Medicaid and CHIP, generally undocumented immigrants aren't eligible for that. But if someone has an emergency medical condition and they are otherwise eligible for Medicaid, so they're very low income, they're, in most states they have to be a child or elderly or have some kind of disability. In some states they cover adults, so they have to meet those criteria as well. But if they have an emergency, they may be eligible for emergency Medicaid, so it will just cover the emergency that happens. Also, and emergencies include labor and delivery, so that's also an important protection. In all states, if someone who's undocumented goes into labor, then emergency Medicaid can cover the labor and delivery. There are some states, about 15 states, where a pregnant woman who's undocumented can get full coverage care for her prenatal care, for labor and delivery, and for the postpartum period. That's just a handful of states. It's not all states, but in some states, pregnant women do have considerable coverage, and that includes a big state like New York.
Okay. I think that's really good to know, that the safety nets still provide services for Caribbean people who are undocumented here, because I think what we're hearing from the Affordable Care Act can make people a little bit nervous about what that means for their health and quality of life moving forward. Now, there's a group of Caribbean people here in the U.S. who fall under this status of deferred action. Can you tell us what is deferred action and how does that affect your access to health care?
Sure. So deferred action by itself is something that's been around for a long time. It's a form of administrative relief. The action that's being deferred is deportation. So someone who is otherwise undocumented, they may have a good reason for why they shouldn't be deported back to their country and can apply for deferred action. But what happened recently that is exciting is the president announced a new policy called Deferred Action for Childhood Arrivals. So it creates a new category of folks eligible for deferred action who we refer to them as dreamers. So people who came here as young people and are undocumented and have no other path to legalization. They can apply for deferred action from the government. And it's basically a temporary reprieve from deportation. It doesn't provide a path to legalization or to citizenship at this time, but at least it provides a temporary reprieve from deportation. It also provides a work permit. They may be eligible to apply for a work permit. So that's very exciting. In terms of health reform and how this fits with access to health care, individuals who are granted deferred action are generally considered lawfully present. So they're eligible for buying health insurance in the exchanges and for the discounts in the exchanges. Not for Medicaid in most places, but for those other programs. So when the president announced deferred action for childhood arrivals, we were all very excited, including about health reform, because we thought those folks would have access to the exchanges. But then a couple weeks ago, they changed their policy and carved out individuals granted deferred action through the DACA process, Deferred Action for Childhood Arrivals, from being eligible for the benefits of health reform. And so now these new folks granted deferred action, these dreamers, are basically going to have the same access to health care and health coverage as people who are undocumented right now.
Oh, wow. So let's say someone is pregnant and fits under this deferred action for childhood arrivals category. What does that mean for her when she is pregnant? Can she access prenatal care? What does that mean for her?
Yeah. So in general, across the country, someone in that situation, if they're are undocumented. And so, in some of those states that cover prenatal care and labor and delivery for folks regardless of status, they would be able to get prenatal care. And so that's like 15 states, including New York is one of those states where someone, if they're undocumented or if they have deferred action for childhood arrivals, they can get prenatal care through Medicaid. Otherwise, in other states, they would only be able to get Medicaid coverage for labor and delivery, but they would not have health insurance for any of the prenatal care, which of course is super important for a healthy pregnancy and for a healthy birth. and delivery. So it's definitely a problem for people granted deferred action through the childhood arrivals process.
Right.
In most states.
Similarly, I know of a colleague who has a friend whose son, right, was granted this deferred access through childhood arrivals status, and he has diabetes. What does that mean for what he has to pay for when it comes to care, or how he accesses care when the Affordable Care Act is implemented?
So again, it's going to be like he's undocumented. So he's not going to have access, in most cases, he's not going to have access to health insurance.
Right.
So for someone who has a chronic, and they're not eligible for the pre-existing condition insurance plan either, because you have to be lawfully present, and they're carved out of eligibility for that program as well, even though we think of them as being lawfully present now. So they would have to access care at community health centers and try to pay on a sliding scale. But for someone with a chronic disease like that, it's very difficult and very expensive, especially with medications that they need as well. So we have a ways to go still.
Wow. So, I'm really interested in this deferred action status, and so imagine that I am someone who has this status. I'm employed, but my employer does not cover insurance for me, right? I just went to the emergency room, which, you said is one of the places people go to access care, and I found out that I have breast cancer, right? What are my options? Where can I go for treatment? How do I pay for the treatments for this breast cancer?
Unfortunately, I don't have a lot of good answers because, people can try to buy health insurance outside of the exchanges. They can try to buy it, private health insurance, and pay full cost for it. Of course, that's going to be prohibitive if people can't afford it or on limited incomes. So again, it's hospitals on their discount programs and community health centers on their discount programs. The good news is that in some states like New York, individuals granted deferred action through the DACA process are eligible for Medicaid in New York and CHIP in New York. And so they can get coverage for cancer treatment and full coverage for their health care in a state like New York. States like Florida, other states in the country, it's going to be different, but New York is a special case that we want to highlight.
Okay. So, we've been talking a lot about the Affordable Care Act, and I just realized that the reason why the act was even introduced was because healthcare in the U.S. was so expensive. What does this act do for the cost of insurance and the cost of healthcare in the U.S. for Caribbean people who are trying to access it?
Well, that was one of the primary goals of health reform, was to bring the cost down. And the health insurance exchanges are one of the big ways that this happens. Because what the health insurance exchanges do is that they put everyone into the same pool of coverage, which means that people are paying into the insurance. And so as a result, premiums go down.
Got it.
And the cost of private health insurance plans go down because there's more people paying into it. And that's the benefit of having the insurance exchange. Right now, in the individual market, it's each plan for themselves. So if I'm paying a premium, I'm paying, the cost of the care is coming out of my premium. So if I'm really sick, then my insurance is going to be really expensive. But if my contribution is going across, if everyone's paying into this insurance plan, then that means that there's more people helping to pay for my health care, and it spreads the risk, is what it's called, and it just brings the cost of health insurance down. It's a basic rule that more people who have health insurance, the cheaper it is.
Right.
And that's what it was trying to achieve.
So do you think it might achieve that? We don't know yet because it hasn't been implemented, but what are we seeing now with regards to costs? Has there been any reduction since this law has been introduced, or do you have that information?
There hasn't been a reduction in cost, but it's been, before the premiums, the cost of premiums were going up at really high rates, and they've gone up at lower rates. So it's not getting as expensive as quickly because of the health reform law, even though the cost is still going up.
Got it.
So that's one good thing. But you're right, these costs, all of this depends on how many people apply for health insurance, which is why it's important for people to know about their new options for health insurance after 2014 and to apply for it if they're eligible, because that's when you really see all of the economic benefits for everybody and for the healthcare system as a whole become a reality.
You just touched on a really important point. It's important for people to know, right? So you're talking about that awareness piece, which I think our goal today is to bring more awareness to Caribbean people, whether they are documented or undocumented here in the U.S., about healthcare, the Affordable Care Act and healthcare reform. But I'd love to hear from you, what can Caribbean people do about the Affordable Care Act, either as individuals or to advocate for this act or for other acts? What should Caribbean people be doing?
So I think one thing is that it really is going to benefit a lot of people, and it's going to benefit most immigrants. And so we need to protect it. We want to make sure that it keeps on going. It's going, our healthcare system is going in the right direction thanks to the Affordable Care Act, and so we want to make sure that it sticks around. And then I think the other piece is just, getting information about it. Because like I said, I mean, we've tried to talk about it today, and it's super, super complicated. And so it's important that people get information from local agencies and organizations where they live, because the rules are different everywhere. So, go to your local government, go to your local organization that helps immigrants, and get more information about it. The federal government has set up a new website called healthcare.gov.
Healthcare.gov.
Yes.
Okay.
And so if you go to that website, it'll connect you to information about each state and the options in each state, which is also a good place to start. And then, like I mentioned, is that there's going to be consumer assistance programs in each state, which is an excellent way for immigrant communities to actually get involved and be some of the people who are providing information, to get training on what the Affordable Care Act does and what new options are out there. There's grant money available to groups that want to do education on the Affordable Care Act and want to help people enroll. It's a fantastic opportunity for immigrant communities to get involved and to actually get some funding to do some education.
Oh, good.
So I think that's also really important.
Awesome. And, undocumented immigrants can also access information from these sources as well as from community health centers in the neighborhoods and
I think
communities.
that's an excellent point. Is that we're hoping that when states are setting up their exchanges and when people are doing this outreach in the consumer assistance programs, they recognize that there will be mixed status families who are coming to the exchange. There are people who are undocumented who aren't eligible for health insurance but could be referred to the local community health center or to the local hospital that has a discount program, all of that. So it's important that those options are integrated into this education.
Jenny, thank you so much for all of this information. It's been full. I think we've gotten a lot of information. I've gained a lot of information that I did not have about the Affordable Care Act. We heard about healthcare.gov, a resource for us to get more information. And we've also heard that this is a law that we should be protecting because it increases access for us to healthcare. So again, thanks a lot. Thank you so much for viewing. If you've seen this, talk to someone else about the Affordable Care Act. We here at Carib Nation TV, we do have a motto, and I want you to remember that. And it is one people, one culture, one Caribbean, one nation. Thank you for viewing.